Hey, coming back in the studio right now is Dr. David Klein. Robin is here as well, and we are here to give you some very, very useful medical advice. And we're starting off today talking about chronic illnesses, and we're talking about surviving antibiotics. And you're probably thinking that's a strange title. I have to survive antibiotics? Well, let's get to the meat of this thing.
Well, the issue at hand, okay, is that chronic illnesses are far more likely to occur as you get older. And if you're successful, you get older. So you start accumulating illnesses very much like you would accumulate stones into a sack that you have over your back. You walk along a little bit and pick something up, throw it into the sack. You walk a little bit further through life, you throw another stone into that sack. And you're accumulating injuries, you're accumulating proclivities, and accumulating illnesses as you go. So everything is more common in folks that are older. Think about it. It just has to be that way. All right. Well, what happens? Very, very frequently, as you're going along through that path of life, picking up those little stones, somebody is going to go, oh, gee, I want an antibiotic. And it's almost always driven by the patient. Because the doctors, for the most part, are reluctant to write antibiotic prescriptions without knowing that you have a bacterial illness. They're very unlikely to sell you the idea that you should be taking an antiviral unless they know that you have a virus. If it's some type of a parasite, they're not going to start you on a parasitic medication unless they're pretty darn sure that that's what this is all about. And the reason is this, that an antibiotic has toxicity to it against mammalian cells just the same as it does against bacteria, virus, and parasites. The difference is that it's more toxic, more deadly to them than it is to us. Now, what's the difference between an antibiotic and an anti-cancer medication? The answer is nothing. Most of the anti-cancer medications have names, and those names are just very similar to the sorts of names that you might see on an antibiotic. And that's not a coincidence. So an anti-cancer medication has a greater mammalian toxicity than does an antibacterial antibiotic. And that's just the way that these things work. So the docs know this, and they're going to try to discourage you, but you're going to go, well, I have a sore throat. I need an antibiotic. And in my office, generally speaking, what I'll do is I'll say, okay, fine, you have a sore throat, but you're probably an idiot too. Now, I will not give you an antibiotic to deal with a viral sore throat because it's going to pass on its own. How do you know? By feeling the nodes in your neck. When they're in the back of the neck, it's almost always viral. And most people with strep, okay, and you can determine whether it's strep or not very, very quickly with a blood study or a swab, okay, you're going to get better by itself. But when you give people antibiotics, okay, you do in fact have this mammalian toxicity issue, but you also have selection of resistant organisms. So let's say that you have 2,000 or 3,000 different varieties of bacteria in your gut. Okay, those are going to be different, and they differ about every 10 feet. Okay, they change. Okay, it's very much like the population of the United States. You start off in Easton, Maryland, you go to San Francisco, you're going to run into different populations of people. The same thing is true from your teeth to your tail with regards to the GI flora. Okay, but when you take an antibiotic, it's very much like nuking the whole country and hoping that somebody will survive. It doesn't end well when things start to grow back. You may end up with segments of the population that you may not feel all that comfortable with now taking over, and that's what happens with the body. Not a clever way to go. What's more, okay, when you're taking antibiotics that way, it tends to result in overgrowths in other areas that you're not intending to go, like the sinuses. So you give somebody antibiotics for bronchitis, for cough and sore throat, or even an infection on the skin. It can lead to fungal infections in the sinuses. And this is far more common than you'd believe. If you're taking Flonase or similar these sprays, these steroidal sprays for chronic sinus infection, I would bet dollars to donuts that you've got yourself a fungal overgrowth in your sinuses that's never going to go away until you do something rather dramatic about it. Why? Because you're feeding a kid with ADD chocolate, sugar, and a shot of Jack, okay? And then wondering why the kid is bouncing all over the walls. So these sorts of infections get worse with antibiotics. We're making our patients worse over time. And what's more is that when you do get sick, the antibiotics that we have on hand don't work real well. And that's a real shame. But that's a fact. So, we're looking at disorders like tuberculosis. It used to be that you could fix tuberculosis with one medication. ethambutol or INH would work just fine. Now you're having to use 2 and 3 at a clip because the bacteria are becoming resistant to it. MRSA never had methicillin-resistant staph. Okay, now we're having to treat it with multiple antibiotics because we have killed ourselves this way. We have made ourselves vulnerable to otherwise common illnesses because of the flip and irresponsible use of antibiotics. So you need to resist the temptation of asking the doctor or the PA or the nurse practitioner or the vending machine, if you happen to be in Mexico, for an antibiotic when in fact it may be one of the worst things that you can do. Now, you end up with a urinary tract infection. Okay, so you ended up going to Bangkok and you came back with a urinary tract infection. All right, antibiotics are appropriate. Not a bad idea. You're coughing up blood. Not a bad idea to have it checked out. Make sure that you don't have TB. So antibiotics have a place, but not as a demand item. What you want is, instead of going in and asking for these damn things, you want to go in and ask the following question. What's wrong with me, and can you fix it? Okay? If the doc is burned out and just wants to get you out the door, they'll throw an antibiotic at you and out you go. That's not a good doctor. That's either a very, very lazy one or one who's been beaten up by life. Neither is acceptable. What you really need to do is to look at the situation, figure out what's wrong, and then mend it from there.
Mm-hmm. So I keep thinking in my mind as you're talking, follow up, follow up, follow up, follow up.
You have to.
In case these things are taking an adverse effect somewhere else.
You absolutely have to. Okay, why? Because at the end of the day, every time you intervene, it's an educated guess. Okay, it is a wild guess. You're looking at somebody and you're going, well, I think this is what's going on. Now, the doctor can look very, very erudite. They can be arcane in their discussions, look at you over their spectacles and go, well, you have, and then pick out some polysyllabic. Well, the fact of the matter is, okay, that even with the lab data, you're still taking a guess because many of these things don't show. Many of these things are falsely interpreted. And as a lab director, one of the things I will tell you is that one lab study in 20 is going to be an outlier just statistically. It doesn't mean that it's wrong. It means that those are the parameters with which we work. Not all measurements are going to be accurate. 19 out of 20 is actually what we work with. And you would think that that's an abomination. I would have to agree with you. So what do? You repeat before you make a very profound decision. So if you had a biopsy, well, I've got this bump, lump, whatever, and you get a piece of it and you get to look at it, okay, a meaningful oncologist is going to want to see the slide. They're not going to take the pathologist's word for it. And a really good one is going to redo the biopsy to make sure that it was yours, because I can't imagine a worse situation than to be treated for somebody else's cancer. And if you don't think that this happens, you would be wrong. So you don't go into these sorts of situations relying on one set of labs.
I've heard a lot of doctors tell their patients, I'm giving you a prescription for so many antibiotics. Take the entire bottle. Don't just get to where you feel better and put it away.
And half of them don't follow the instructions.
That's what I'm saying, yeah.
Yeah, and so what happens here is that they think that they're getting by. Well, I can save an office visit, against this antibiotic, and you got to be crazy. What happens is it's very much like allowing paint to dry. If you're going to paint a room and you're told by the painter that it's going to require 2 or 3 coats to cover properly, and before you do that, you'd better prep, and after that, you'd better clean up, and you decide you're going to get by with 1 coat because you're smarter than Sherwin-Williams, smarter than the painter. It doesn't work that way. It's follow through in baseball, it's follow through in golf, it's follow through in tennis, and it's follow through in medicine. You have to completely eliminate the bacterium, the virus, the parasite, to the extent that it's at all possible before you discontinue the use. Listen to the instructions. They are meaningful. Their intent is your benefit, not your detriment.
Okay, Robin, do you have contact information so that we can go down and gain on this expertise that we have right here?
Absolutely. Give us a call at 407-679-3337 to make an appointment or order some supplements. You can also read about us and find out more on the web at stagesoflife.net. Our office hours are Monday through Thursday, 8 to 5. The health store is open during office hours, and you are invited to come on in. We are also on Facebook at Stages of Life Medical Institute.